Did you know that the #1 diabetes medication in the world actually came from a plant that was used in medieval medicine? I'm gonna tell you everything that you need to know about Metformin, which is the generic for glucophage. So the only FDA approval for this medication is for type 2 diabetes, but I know some of you may use it off-label for weight loss or PCOS. But we're really just gonna focus on its use for diabetes for today. In simple terms, it helps your body control sugar, especially after meals. So sugar stays in your cells for energy instead of floating in your bloodstream. Most people should be starting on just 500 milligrams once a day. Then you're slowly titrated up by 500 milligrams once a week until your blood sugars are stable. But if your doctor starts you on 2000 milligrams right away, that's a red flag. Which I'll explain why when we talk about side effects. So this medication does a lot for patients with diabetes. It works by activating AMP activated protein kinase, which is your body's metabolic energy regulator. So when metformin turns on AMPK, a couple things happen. It decreases hepatic gluconeogenesis, which just means your liver stops making extra sugar. It increases insulin sensitivity, especially in the muscle. It also enhances peripheral glucose uptake and reduces intestinal glucose absorption. But this is really important. Metformin does not stimulate insulin release, which is why you'll notice it doesn't cause hypoglycemia, which is low blood sugar, on its own. I know that was a lot. Let's give an analogy. Think of your liver like a bakery that keeps over baking sugar cakes overnight. Metformin pretty much works by telling the bakery, which is your liver, to stop baking, like we're good. In turn, it's actually gonna help your muscles use the sugar that's already there. Now let's get into the reason why a lot of people stop metformin, which is gonna be the side effects. Most common are gonna be diarrhea, nausea, upset stomach, and gas. Usually you'll notice this when you're first starting or increasing on a dose, but it should eventually go away. As I alluded to in the beginning, if your doctor starts you on 2000 milligrams right away, you're gonna be stuck in running to that bathroom, so it is not recommended to be started that high. Which is why I always say we go low and we go slow. The extended release formulation of metformin actually has less GI side effects. Usually if the patient insurance covers it, I would always just start them on metformin ER just to prevent any of those side effects. And for a really rare but severe side effect that I have to mention is lactic acidosis. Honestly, it's mainly a risk with people with significant kidney problems. It's due to the body just not being able to clear out the metformin as well. Symptoms to look out for are severe fatigue, muscle pain, trouble breathing, stomach pain, feeling cold, dizziness, or even rapid breathing.